Hello, Ms. Berry. I'm Cherie. I'll be your nurse today.
All right.
Today we're going to do an assessment of your cardiovascular system, your respiratory system, and your gastrointestinal system.
Okay.
All right. I'm going to start by sanitizing my hands. And can you tell me your first and last name?
Berry.
And can you tell me your date of birth?
3/20/81.
All right, Ms. Berry. And what are you here for today?
For physical.
All right. So first I'm going to start off by checking your blood pressure. Your blood pressure is 112/62, which is great. Next, I'm going to check your pulse, your radial pulse, for a full minute. All right, Ms. Berry, your heart rate is 82, and your respirations are 18. Next, I'm going to check your temperature. All right, your temperature is 98.1. Great. So the next thing we're going to do is I'm going to start by checking your respiratory system first. Do you have any problems, infections in your respiratory system?
No, just minor allergies.
Okay. Do you have any cough, cold, congestion?
No.
Any shortness of breath?
No, ma'am.
All right. So I'm going to start off first by inspecting the anterior chest. I'm looking for any lumps, bruises. I'm looking for the color. I'm going to feel for the temperature, make sure temperature is not moist. I'm going to do the same with the back, inspect the back of the chest. All right. Now I'm going to palpate. Any tenderness?
No.
All right. Any tenderness?
No, ma'am.
I'm checking for tenderness, masses, lumps. Now I'm going to percuss. Going side to side. And on the posterior. You slide up for me, Ms. Berry? Thank you so much. And that all sounds normal and equal from side to side. Last but not least, the respiratory system. I am going to auscultate. And when I place the stethoscope, I like to take a deep breath in and blow it out. And the same on the back. One more time. And now I'm going to auscultate and listen to the lateral aspect of the chest. Deep breath. And on the other side. Great job. Now I'm going to check for tactile firmness. Every time I place my hand, I want you to say 99.
99, 99, 99, 99,
And on the posterior?
99, 99, 99, 99, 99, 99,
One more time.
99.
All right, and those are equal. Next, we're going to check for symmetrical expansion, and I would like for you to turn this way for me. I'm going to place my hands on your back, and I would like for you to take a deep breath in. Do that one more time. Great. All right, can you turn back around for me, Ms. Berry? The next system that I'm going to assess is going to be your cardiovascular system. And for this, I'm going to do pretty much the same that I did for the respiratory. I'm going to inspect the anterior chest, make sure there's no bruises, marks, scarring. Do the same on the back. And then we're going to palpate the posterior chest. Any tenderness?
No, ma'am.
All right, just feeling for masses, lumps, bumps. Checking the skin for any rashes, lesions. All right, all looks good. Checking the moisture and the temperature of the skin. All right, so next we're going to auscultate, which we're going to listen to the carotid arteries on both sides. All right. All right, we're going to listen to her apical pulse for a full minute. All right, S1 and S2 heart sounds are present. There is no presence of a murmur. The next system that we're going to check is going to be the gastrointestinal system. And for this, Ms. Berry, I would like for you to lay on the stretcher for me, please. Thank you, Ms. Berry. So with the gastrointestinal system, we're going to be checking the abdomen. First, I want to inspect the abdomen. I'm just looking at the skin, making sure there's no rashes or lesions on the anterior abdomen, excuse me. All right. And then I am going to auscultate, which I am going to listen to bowel sounds in all 4 quadrants. And with my bowel sounds, I do like to listen for at least 30 seconds to a minute. Vowel sounds are present in all 4 quadrants. Ms. Berry, do you have any problems with your abdomen or gastrointestinal system?
No, just some constipation from time to time.
Okay. Any nausea, vomiting, diarrhea?
No, no, ma'am.
And how many bowel movements do you have per week?
About 3.
Okay. And have you had any abdominal surgeries?
I have not.
Okay, thank you. The next thing with the abdomen we're going to do is palpate. I'm going to palpate the abdomen, starting with the lower left quadrant. Now, Ms. Berry, tell me if you feel any tenderness.
I don't.
I'm sorry, the lower right quadrant. And then the lower left quadrant. Any tenderness?
No, ma'am.
All right. The upper right quadrant. Any tenderness?
No, ma'am.
And the upper left quadrant. Any tenderness?
No, ma'am.
Okay. I'm also feeling for masses. And on Miss Berry, since she is a larger woman, I'm not able to palpate the liver, but the liver is here. On a smaller person, you would kind of feel up under the rib and try to palpate the liver. All right, Miss Berry, the next thing I'm going to do is percuss the abdomen.
Okay.
And I'm listening for dullness. All right, Ms. Berry, do you have any questions about this exam today?
Has everything seemed normal?
Everything seems pretty normal. Your blood pressure, vital signs are all normal. I found that your respiratory rate was equal. Your breath sounds were equal and normal. No adventitious breath sounds were present. You do have active bowel sounds in all 4 quadrants. You do have the presence of a S1, S2 beat of your heart, and there are no more murmurs present. Any other questions?
No, ma'am.
All right. Thank you so much, Ms. Berry. It was a pleasure doing your assessment today.
Thank you.